Hello everyone, today we are going to be talking about postpartum cardiomyopathy. Cardiomyopathy is a rare form of heart failure that affects women during or soon after pregnancy. Estimates suggest that it occurs in 1 out of 1300 to 2000 pregnancy. Postpartum cardiomyopathy typically presents with shortness of breath, chest pain and fatigue. It can also be fluid buildup in the lungs and abdomen. If the left untreated, it leads to heart failure and death. The exact cause of postpartum cardiomyopathy is unknown, but it's believed to be related hormonal changes brought on by pregnancy and in childbirth. In addition to certain risk factors can be increased chances of developing postpartum cardiomyopathy, such as carrying multiple babies or having preeclampsia during pregnancy or history of heart problems. While the symptoms associated with postpartum cardiomyopathy are serious, and the good news is about the prompt treatment and the prognosis is usually positive. Typically focus on relieving symptoms and reducing the risk for further heart damage. This may include lifestyle changes such as reducing salt and caffeine intakes, medications such as diuretics, heart medications designed to reduce the fluid buildup, and in some cases like surgery. It's important for new mom to be aware of signs and symptoms of postpartum cardiomyopathy and seek medical help if they experience them. If you have any questions or concern about the postpartum cardiomyopathy, you should speak to your doctors for more information and advice. Thank you for listening.